Hello, this is Dr. Stanley Lang, and welcome to this video broadcast. And the focus of the broadcast today is on whole person health and how strength training plays a role in long-term wellness. So as a family doctor, one of the things that I see a lot of are the aches and pains of people as they go through life. And as people get older, as you probably know, they tend to accumulate more aches and pains. And so I've always been a proponent of being very active, maintaining a good exercise program, including all three of the main types of exercise, which include number one, cardiovascular exercise. The second one is flexibility exercise, and the third is strength training. So a lot of people have problems, especially with the third one. They manage to squeeze in some sort of a cardiovascular workout, even if it's just a simple walk. Some people will do some stretching, but not very many people are successful in doing a strength program, partly because it's hard for them to get to the place to do the strength program. And having a good home-based strength program is an obstacle for many people to overcome. And so they never really get into a strength program. So I saw a patient yesterday who his main complaint was one that I see a lot, which is that his neck was hurting and his upper shoulders were hurting. And just like most other people in his age group, and he's above 50, actually in this case above 60, but most people above 50 and even younger tend to have what I call a head forward posture. That means that their head is stuck forward like this and their shoulders are rolled forward like this. Now I'm exaggerating a little bit, but that's basically how they sit or walk all day long. And they're so used to doing it, they don't realize that their posture is not good. And so what that does is put chronic, continuous stress on the muscles that support the neck, and they start to develop overuse symptoms. And you become very sensitive to trivial kind of injuries that aggravate that and trigger a variety of chronic symptoms, including most of the headaches that people have. So headaches are a very common issue. And one of the main reasons that people have headaches, which are called tension headaches, which are actually muscle contraction headaches, is because of this posture issue that I just told you about. So with this patient, I told him that he really needed to get into a core strength exercise program, especially one that emphasized building up the muscles in the upper part of his body, because he does walk. And so he's not completely weak in his legs, but he is obviously not in good balance in his upper body. And we spent the whole rest of the time talking about all the different things that you can do to get into balance, because when you're in good balance, your skeleton is holding you up. When you're in bad balance, you're using your muscles to hold you up, and they have to work a lot harder and continuously if they're tasked to be holding you up. So if you want to have a proactive approach to dealing with stuff like neck pain or headaches or other basic musculoskeletal symptoms that plague people of all age groups, but particularly as people pass age 50 and onward, then you need to have a good strength program. So I have developed a very simple five exercise program, and I'm going to give you a free report on that program, a free introduction on these different exercises that are part of it and why they're critical, just by clicking on the link below this video. So you'll be able to construct your own program from the free report, or obviously I'm going to give you access to purchase this program. It's very modestly priced, but if you just want my idea of what the 5 key exercises, the 5 most important exercises to build your core strength, then click on the link below and you can get that free video report. And I'm going to talk to you about what those 5 exercises are. So I wish you well. I encourage you to be committed to a regular strength program, and have a great day.